Hello everyone, welcome back to part 4 of our series on the muscles of the lower limb. In the previous videos, we completed the muscles of the hip region, including both the superficial and deep gluteal muscles. If you have not watched those videos yet, I recommend watching them first as they will help you better understand the topics we will cover in the upcoming videos. So now let's continue our topic. Today we are going to learn about the muscles of the thigh. The thigh muscles are divided into three compartments: anterior, medial and posterior. In this video we will focus on the muscles of the anterior compartment of the thigh, okay? The main muscles of the anterior compartment are sartorius and quadriceps femoris. So we will begin with the sartorius muscle and then move on the quadriceps femoris muscle group. First one is sartorius muscle. Sartorius muscle origin. It originates from the anterior superior iliac spine, that is ASIS, and inserts into the proximal part of the medial surface of the tibia just below the medial condyle and as a part of pes anserioris. Nerve supply or the sartorius muscle is supplied by the femoral nerve and its branches, okay? Just remember femoral nerve. And blood supply is provided by the branches of femoral artery and the deep femoral artery. The functions at the hip joint, it flexes the thigh, abducts the thigh and laterally or externally rotates the thigh. At the knee joint, it flexes the leg and medially or internally rotates the leg when the knee is flexed. And daily life examples: crossing one leg over other while sitting, cross leg sitting, and sitting in cross leg position and climbing stairs, bringing the foot up to tie shoelaces. Just remember this example. And sartorius helps you sit cross-legged. If you remember that position, you can easily recall its action, that is flexion, abduction and external rotation of the hip and flexion of the knee. So this muscle is also known as Taylor's muscles. So next one muscle is quadriceps femoris. It is not a single muscle. Okay, it's a group of four muscles which is called as quadriceps. So meaning is four-headed muscle. The four muscles of the quadriceps femoris are the rectus femoris, vastus lateralis, vastus medialis and vastus intermedius. So these four muscles work together to form the quadriceps femoris, which is the main muscle group of the anterior compartment of the thigh. Okay, we will discuss each one of them individually. So let us discuss the four muscles of the quadriceps femoris group. First is origin. So rectus femoris originates from the AIIS, that is anterior inferior iliac spine, and the area above the acetabulum, that is also known as supraacetabular groove. Okay, and vastus medialis, that is originates from the intertrochanteric line and the linea aspera of the femur, and vastus lateralis originates from the greater trochanteric and the linea aspera of the femur. Okay, then vastus intermedius, it originates from the anterior and lateral surfaces of the shaft of the femur. Nerve insertion point: all four muscles, that is rectus femoris, vastus lateralis, medialis and intermedius, all muscles unite to form the quadriceps tendon, which inserts into the patella. From the patella, the patellar ligament continues and attaches to the tibial tuberosity. Therefore all four group muscles ultimately insert into the tibial tuberosity through the patellar ligament. Okay, and now supply, all four muscles are supplied by the femoral nerve itself, and blood supply is mainly provided by branches of the femoral artery and the deep femoral artery. Functions of quadriceps femoris muscles are: at the hip joint, rectus femoris flexes the thigh. At the knee joint, all four quadriceps muscles extend the leg at the knee joint. Okay, so daily life examples, I give some examples: standing up from the chair and climbing stairs, walking and running, kicking a ball and straightening the knee while standing, the extension of the knee. Just remember that. So quadriceps femoris is the primary extensor muscle group, okay, of the knee joint and plays everyday activities, and only rectus femoris crosses both the hip and knee joints. Okay, so it can flex the hip and extend the knee, but other three muscles are there, right? Vastus muscle, they are mainly extend the knee. Okay, so this is a main viva question. It's a common exam viva question, remember this. So now I'm going to show you some images of the individual muscles of the quadriceps femoris group. The first image shows the rectus femoris, the second one shows the vastus medialis, and third image shows the vastus lateralis, and the fourth one is vastus intermedius. So please take a moment to observe each image carefully so you can identify the location of each muscle. So understanding their position will make it easier to remember their anatomy and function. So go through these images and try to correlate them with the origin, insertion and actions that we have just discussed now. So next one is the most important part of our video, that is the note point. So in this section I'll share some easy memory tips to help you remember the anterior compartment muscle of the thigh. First point is sartorius muscle, about sartorius muscle. So an important exam point is that the sartorius is the longest muscle in the human body. So if you are asked which is the longest muscle in the human body, the answer is the sartorius muscle. Okay, so next point is nerve supply. So both the sartorius muscle and the quadriceps femoris muscle group are supplied by the femoral nerve. So whenever you think of the anterior compartment of the thigh, remember one key term, that is femoral nerve. Okay, next, blood supply. The muscles of the anterior compartment of thigh are mainly supplied by branches of the femoral artery and the deep femoral artery. Okay, all muscles. Then insertion of the quadriceps femoris. So all four quadriceps muscles join together to form a quadriceps tendon, right? So which inserts into the patella. From the patellar ligament continues and attaches to the tibial tuberosity. So therefore, all four quadriceps muscle ultimately inserts into the tibial tuberosity through the patellar ligament. So if you remember these 4 points, revising the anterior compartment muscle become much easier. Okay, we have now completed the main muscles of the anterior compartment of the thigh. Okay, so however there is one additional muscle that you should know about called the articularis genu muscle. So as you can see in the picture, the articularis genu is the small muscle located deep to the vastus intermedius muscle. So origin is anterior surface of the distal femoral shaft, and insertion is capsule of the knee joint. So it sometimes overlooked because of its small size. So its function is it pulls the knee joint capsule upward during knee extension, and this prevents the capsule from being trapped between femur and the patella during movement. Okay, so this muscle is not commonly emphasized in basic anatomy, but it is useful to remember for a complete understanding of the anterior compartment of the thigh. So this muscle protects the knee capsule. Whenever the knee extends, this small muscle pulls the joint capsule upward to prevent a pinching. So this is the easiest way to remember its function. Okay, just remember this. So this is the end of today's video, which was part 4 of our lower limb muscle series. In this video we discussed the muscles of the anterior compartment of the thigh. I hope you found it easy to understand and helpful for your studies. In the next video, part 5, we will learn about the muscles of the medial compartment of the thigh. And thank you so much for watching this video. And if you found this video helpful, please like, share and subscribe to the channel. If you have any questions or doubts regarding to topic, feel free to leave them in the comment section below. I'll do my best for help you. And thank you once again for watching this video. See you in the next time.